Hey there, welcome to my channel. Nurse ME here. I have picked some practice questions for you. If you find this video helpful, be sure to hit the like button. And do not forget to leave a comment below with how many questions you got right. Feel free to ask any questions. I'm here to help.
A patient with chronic renal failure is prescribed erythropoietin. Which laboratory value should the nurse monitor to evaluate the effectiveness of this medication? A. Serum potassium levels. B. Hemoglobin levels. C. Serum creatinine levels. D. Blood urea nitrogen (BUN) levels. The correct answer is B. Hemoglobin levels. Erythropoietin is used to stimulate red blood cell production, so hemoglobin levels should be monitored to assess its effectiveness. Serum potassium, A, creatinine, C, and BUN levels, D, do not directly indicate the response to erythropoietin therapy. A patient is admitted with suspected bacterial meningitis. Which of the following is the most important initial nursing intervention? A. Start the patient on broad-spectrum antibiotics. B. Initiate seizure precautions. C. Administer IV fluids to maintain hydration. D. Perform a lumbar puncture. The correct answer is A. Start the patient on broad-spectrum antibiotics. Early administration of antibiotics is crucial in bacterial meningitis to prevent complications and reduce morbidity and mortality. While seizure precautions, B, IV fluids, C, and lumbar puncture, D, are important, antibiotics must be started promptly. A patient with a traumatic brain injury, TBI, is being monitored for increased intracranial pressure, ICP. Which of the following is a late sign of increased ICP? A, headache. B, vomiting. C. Bradycardia. D. Restlessness. The correct answer is C. Bradycardia. Bradycardia is a late sign of increased ICP, often associated with Cushing's triad, bradycardia, hypertension, and irregular respirations. Headache, A, vomiting, B, and restlessness, D, are earlier signs. A patient with suspected acute pancreatitis has severe abdominal pain radiating to the back. Which laboratory result is most indicative of acute pancreatitis? A. Elevated serum amylase. B. Elevated serum lipase. C. Elevated liver enzymes. D. Decreased serum calcium. The correct answer is B. Elevated serum lipase. Elevated serum lipase is more specific for acute pancreatitis compared to serum amylase. A. Elevated liver enzymes, C, may indicate liver involvement, and decreased calcium, D, can occur but is not as specific. A patient with chronic obstructive pulmonary disease, COPD, is prescribed long-term oxygen therapy. Which of the following statements indicates the patient understands the use of oxygen? A. I can smoke as long as I use the nasal cannula. B. I should use oxygen continuously, even when I feel fine. C. I should increase the oxygen flow rate if I feel short of breath. D. I should use oxygen only when exercising. The correct answer is B. I should use oxygen continuously, even when I feel fine. Continuous use of oxygen therapy is essential for patients with severe COPD to maintain adequate oxygenation. Smoking, A, while on oxygen is extremely dangerous. Increasing flow rate, C, without medical advice is not safe, and using oxygen only when exercising, D, is insufficient. A patient with sepsis is being treated with vasopressors. Which of the following parameters is most important to monitor to assess the effectiveness of this therapy? A. Heart rate. B. Blood pressure. C. Urine output. D. Serum lactate levels. The correct answer is B. Blood pressure. Blood pressure is the primary parameter to monitor for assessing the effectiveness of vasopressors, which are used to maintain perfusion in septic patients. Heart rate, A. Urine output, C. And serum lactate levels, D. Are also important but are secondary to blood pressure in this context. A patient is receiving heparin therapy for deep vein thrombosis, DVT. Which laboratory test should the nurse monitor to ensure the patient is within the therapeutic range? A. Platelet count. B. Prothrombin time, PT. C. Activated partial thromboplastin time, APTT. D. International Normalized Ratio, INR. The correct answer is C. Activated partial thromboplastin time, APTT. APTT is monitored to assess the therapeutic range of heparin therapy. PT, B, and INR, D, are used to monitor warfarin therapy. Platelet count, A, does not indicate heparin therapeutic levels, but is monitored for heparin-induced thrombocytopenia. A patient with diabetic ketoacidosis, DKA, is receiving insulin therapy. Which electrolyte imbalance should the nurse monitor closely during the initial treatment? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. The correct answer is B. Hypokalemia. Insulin therapy drives potassium into cells, which can lead to hypokalemia. Hyperkalemia, A, is common before treatment. Hyponatremia, C, and hypercalcemia, D, are not as directly affected by insulin therapy in DKA. A patient with a spinal cord injury at T4 is at risk for autonomic dysreflexia. Which of the following symptoms would indicate this complication? A. Hypotension and bradycardia. B. Severe headache and hypertension. C. Nausea and vomiting. D. Abdominal pain and diarrhea. The correct answer is B. Severe headache and hypertension. Autonomic dysreflexia is characterized by severe headache and hypertension due to overactivity of the autonomic nervous system. Hypotension and bradycardia, A. Nausea and vomiting, C. And abdominal pain and diarrhea, D. Are not indicative of this condition. A patient with cirrhosis is being treated for hepatic encephalopathy. Which of the following medications is commonly used to reduce ammonia levels in this condition? A. Furosemide. B. Spironolactone. C. Lactulose. D. Propranolol. The correct answer is C. Lactulose. Lactulose is used to reduce ammonia levels in hepatic encephalopathy by promoting its excretion through the bowel. Furosemide, A, and spironolactone, B, are diuretics used for fluid management in cirrhosis. Propranolol, D, is used for variceal bleeding prophylaxis. A patient with severe asthma is prescribed a leukotriene receptor antagonist. Which of the following indicates the patient understands how to take this medication? A. I should use this medication only during asthma attacks. B. I should take this medication every night even if I'm feeling fine. C. I should stop taking it if I don't feel any immediate effects. D. I should take this medication whenever I start wheezing. The correct answer is B. I should take this medication every night even if I'm feeling fine. Leukotriene receptor antagonists are used for long-term control of asthma and should be taken regularly, not just during asthma attacks. Immediate effects, C, are not typical, and taking it only during wheezing, D, is incorrect. A patient with myasthenia gravis is experiencing increased muscle weakness. Which diagnostic test is used to distinguish between myasthenic crisis and cholinergic crisis? A. Electromyography, EMG. B. Hydrophonium test. C. Serum acetylcholine receptor antibody test. D. Computed tomography CT scan. The correct answer is B. Hydrophonium test. The hydrophonium tinsilin test is used to distinguish between myasthenic and cholinergic crisis. Improvement in muscle strength after administration suggests myasthenic crisis. EMG, A, antibody tests, C, and CT scans, D, are not used for this purpose. A patient with a history of peptic ulcer disease, PUD, presents with severe epigastric pain and a rigid abdomen. What is the nurse's priority action? A. Administer antacids. B. Prepare the patient for surgery. C. Administer pain medication. D. Insert a nasogastric NG tube. The correct answer is B. Prepare the patient for surgery. Severe epigastric pain and a rigid abdomen suggest perforation, a surgical emergency. Antacids, A. Pain medication, C. An NG tube insertion, D. Are supportive measures, but preparing for surgery is the priority. A patient with suspected
Guillain-Barré
syndrome is being assessed. Which finding is most characteristic of this condition? A. Progressive muscle weakness ascending from the legs. B. Sudden onset of unilateral facial drooping. C. Chronic muscle fatigue with exertion. D. Difficulty swallowing and speaking. The correct answer is A. Progressive muscle weakness ascending from the legs.
Guillain-Barré
Syndrome typically presents with progressive, ascending muscle weakness. Unilateral facial drooping, B, is more indicative of Bell's palsy. Chronic muscle fatigue, C, is not specific, and difficulty swallowing and speaking, D, can occur but are not the initial characteristic signs. A patient receiving chemotherapy for leukemia is at risk for tumor lysis syndrome, TLS. Which lab finding would indicate this condition? A. Hypocalcemia. B. Hypernatremia. C. Hypokalemia. D. Hypermagnesemia. The correct answer is A. Hypocalcemia. TLS is characterized by electrolyte imbalances including hyperkalemia, hyperphosphatemia, and hypocalcemia. Hypernatremia, B, and hypermagnesemia, D, are not typical findings, and hypokalemia, C, is the opposite of what is seen in TLS. A patient with syndrome of inappropriate antidiuretic hormone secretion, SIAD, is being treated. Which clinical finding is most likely to be observed? A. Hypernatremia. B. Hyponatremia. C. Polyuria. D. Increased thirst. The correct answer is B. Hyponatremia. SIAD is characterized by excess ADH, leading to water retention and hyponatremia. Hypernatremia, A, is not seen in SIDH. Polyuria, C, and increased thirst, D, are more typical of diabetes insipidus, not SIDH. A patient with liver cirrhosis is being evaluated for hepatic encephalopathy. Which assessment finding is most indicative of this condition? A. Jaundice. B. Ascites. C. Asterixis. D. Splenomegaly. The correct answer is C. Asterixis. Asterixis, flapping tremor, is a classic sign of hepatic encephalopathy. Jaundice, A. ascites, B. and splenomegaly, D. are associated with liver disease, but are not specific for encephalopathy. A patient with a history of deep vein thrombosis, DVT, presents with sudden chest pain and dyspnea. Which diagnostic test should the nurse anticipate? A. Chest X-ray. B. Electrocardiogram ECG. C. D-dimer assay. D. Pulmonary angiography. The correct answer is D. Pulmonary angiography. Pulmonary angiography is the gold standard for diagnosing pulmonary embolism, which is suspected with sudden chest pain and dyspnea in a patient with a history of DVT. Chest X-ray A and ECG B are initial tests but not definitive. D-dimer C is a screening tool. A patient with hyperthyroidism is preparing for a thyroidectomy. Which preoperative medication is typically administered to reduce thyroid hormone synthesis? A. Methimazole. B. Levothyroxine. C. Prednisone. D. Atenolol. The correct answer is A. Methimazole. Methimazole is used preoperatively to reduce thyroid hormone synthesis. Levothyroxine, B, is used for hypothyroidism. Prednisone, C, is a corticosteroid and atenolol, D, is a beta blocker used to manage symptoms. A patient with systemic lupus erythematosus, SLE, is experiencing nephritis. Which laboratory finding should the nurse monitor most closely? A. Serum calcium. B. Serum creatinine. C. Serum potassium. D. Serum glucose. The correct answer is B. Serum creatinine. Serum creatinine is monitored closely in SLE nephritis to assess kidney function. Calcium, A, potassium, C, and glucose, D, are less specific indicators of renal involvement.
Thank you very much.